Today at the Rangiora Vet Centre, Rebecca sinks her teeth into the problem of dogs with an appetite for some more unusual items.
Hi, I'm Rebecca Waite. I'm one of the vets at RBC, and today we're going to talk about intestinal foreign bodies in dogs. I've got Honey here, who's a young golden retriever who's our poster child for eating naughty things and getting them stuck. She hasn't had it happen to her yet, but it's probably only a matter of time given her breed and her temperament. We see dogs very regularly with things that they've eaten that have become stuck in the bowel, and the majority of those patients do need surgery to address that, and it's certainly a life-threatening problem. So we'll talk through today the sorts of things that we tend to see, the sorts of objects that we get, and the signs that you might see if your dog had an intestinal obstruction. In the last couple of months, the things that we could think of off the top of our heads that we've seen in dogs' tummies and had to take to surgery include a whole lot of walnuts in their shells, a pair of knickers, corn cobs, stones, a whole towel, which is an impressive effort, and all sorts of other things. Stones are a very common one. Cooked bones, pieces of bones definitely are again a common one. And some of these patients can present really very unwell and in a life-threatening situation. If we catch them really nice and early, it's much easier to help that patient and get away with a less major surgery and a shorter hospital stay. So the sorts of things we'd usually see is a dog who was vomiting and usually pretty depressed. Sometimes they'll have diarrhoea, but not always. Pretty much consistently a vomiting dog, not often feeling like eating as much or drinking as much as normal, sometimes not eating or drinking at all, and usually really quite dull, not their normal energy levels. The breeds that are the most common ones are labs and retrievers and probably beagles, because they're the type that eat anything and everything, but it can happen in any breed, and we certainly do see the problem occasionally in cats as well, who are more prone to eating little threads and ribbons and pieces of wool and that sort of thing. We've got an x-ray up here of one of our patients that we saw a month ago who had eaten some walnuts, quite a lot of walnuts, and there's we can see the shadows of the walnuts here obstructing the bowel, and there's an awful lot of gas in the intestine as well. Walnuts, we're lucky they'll show up on an x-ray, so stones for example, but a towel or underwear, which seems to be a common one for dogs to eat, doesn't show up on an x-ray, and all we'd likely see in that situation are these accumulations of gas which show up as black on the x-ray here, alongside the symptoms that the dog's showing us, and obviously a very painful tender tummy, and in that situation we'll often have to take that dog to surgery to explore on the suspicion that we have got a blockage. Certainly most dogs who we get early enough for this type of problem go on to do very, very well with surgery and a day or two in the hospital, but it would be better if we didn't have to get there. So I guess the moral of the story is supervise your dog really carefully with what they play with and what they eat, and don't feed your dog cooked bones either. Cooked bones definitely are the ones that splinter and break into little pieces and are much more likely to get stuck in their intestine. And if you do think that your dog is showing any signs of an obstruction, getting them to the vet early is going to give us the best chance of getting them well and back on their feet again quickly.
Next time at the Rangiora Vet Centre, Sophie talks to us about caring for our best friends as they get older.